All right, so what is random assignment? I've already mentioned this a few times. And this is where subjects are assigned by chance rather than by choice to either the experimental group or the control group. And randomization reduces the bias as much as possible by rendering the groups equivalent with respect to known or extraneous or confounding variables. If the sample size is adequate and statistical analysis is appropriate, then the randomization can actually help determine if the differences are really due to the intervention under study. Uh, and randomization is really key to determining cause and effect relationships. So, say for example, if we go back to the previous study, the previous slide here, where I was mentioning these inclusion-exclusion criteria. One of the things that we would need to look at in this particular study, oh, sorry, let me go back here. One of the things that we need to look at in this particular study would be the risk factors. And so by randomization, hopefully when we look at our demographics, hopefully the groups will be equivalent on these different inclusion criteria that we're talking about, meaning that there would be equal proportions with one of those prior histories. If not, then that could introduce a potential source of bias. But by doing randomization, there's an equal chance that the women would be enrolled in either one of the two groups. And randomization is a cornerstone of randomized controlled trials or even clinical trials. Um, and there's a number of ways that you can actually randomize patients to groups. And it's important when you read a article. Many times the investigators in the methods section will discuss the method of randomization. Sometimes it's a flip of a coin, maybe it's a computer generated, or even a random numbers table. And a good manuscript will actually be very specific in how they did that. So another example of we were talking about earlier is blocking. And this is where a researcher includes subjects with various levels of the extraneous variable um, in the sample, but controls the number of subjects assigned randomly to the groups. So here's an example of where maybe a confounding or extraneous variable would be academic year of the students. Say maybe these are SRNAs, you have juniors and seniors, and you want to make sure, and you're using some sort of intervention, maybe something to decrease test anxiety. But you want to make sure that you have an equal number of juniors and seniors in either the intervention or the control group. And so you would make sure that your randomization, that you're blocking them. The blocking variable in this case would be academic year, and so that you make sure that you have equivalent number of subjects in each group. Here's just I pulled an abstract off of PubMed. This was a animal study, but a lot of times you can see in those studies, they do use a randomized block design where they may put blocks of the animals in the different treatment or control groups. Matching. So matching is used when a subject in the experimental group is randomly selected and then a subject similar in relation on some extraneous variable is randomly selected and assigned to the control group. So this is in a randomized study, but you also commonly will see matching occur in non-randomized studies or even in observational studies, or non-experimental studies too. Statistical control is another method that's used because sometimes we just cannot control for some extraneous or confounding variable. And so certain statistical tests that we will talk about later in this course can remove or partial out what we call the variance explained by an extraneous variable. And this is what we call a covariate. And so here we have the dependent variable, which is what we're looking at here. We're trying to narrow down that effect, and then we have a certain degree of error, and then we have a certain extraneous variable which may impact our ability to detect a difference. So basically, statistically, we can cancel out that covariant or extraneous variable. All right, here's an example of a use of matching as well as statistical control. And so this is from a paper that we published a couple years ago, where we looked at the association of obstructive sleep apnea with adverse pregnancy-related outcomes in military hospitals. And so what we did in this study was that we actually had we had a database with all deliveries, all direct care delivery related discharge from 2008 to 2014. So we actually analyzed the whole population of deliveries. In this particular study, we did a matched retrospective cohort study design, and we'll talk about that type of design later in this lecture. But what we did use was we used matching to increase our statistical power. We actually matched three age match controls for every patient with OSA. So in this study, I believe we had something like maybe it was around 400 women who had a diagnosis of OSA. So what we ended up doing was we went through the database, which had, I think, close to 400,000 deliveries in it. I don't exactly remember the details. And then what we did is we actually randomly selected and made sure we matched on absolute age 3 control patients to every one case of diagnosed OSA. So that's an example of matching. In this study, we also had we used some statistical controls in our analysis so that we can control for extraneous or confounding variables such as age, ethnicity, hospital characteristics where the women delivered, if they had a history of obesity, and any other clinical conditions or comorbidities that were associated with OSA that you can see listed there. And so in our analysis, we were able to control for those because we could not, because this was a retrospective study, so it was prone to bias. And so we, through statistical controls, we're able to minimize those effects and really narrow down what our true what the true impact of sleep apnea was on peripartum complications.